Hello. Apologize for the small delay. We're going to start the session. So good afternoon, everyone. Thank you for being here. This session today afternoon is about heat waves and wildfires. This is a session that is co-organized between WHO and WMO. And we are very happy to have you here. I have a few housekeeping rules that I would like to remind you. So to keep your mobile phone on silent or vibrant during the session, trying to minimize movement during presentation. If you need to leave, please quietly. There will be the break. The coffee break will be served in this room, if I'm correct. If this information is incorrect, I will let you know in due time. There are emergency exit and safety. Please follow the exit sign and staff direction. Wi-Fi you may know already. And in this room we have interpretation in Spanish and in French. Spanish is channel 1 and French is channel 4. And with this I would like to now introduce our moderator, Professor Tong Tzu. Welcome. Professor Tong Tzu is a professor at the College of Environmental Science and Engineering in Peking, China, and he is also chair of the WMO Working Group on Air Quality, Arch Group, Climate and Health. Welcome, Dr.
Thank you very much, Sophie. Well, this is a very hot topic in this session. We talk about the heat and the wildfires. So we have 3 presentations and we have 5 panelists. So to save your time, I don't want to talk more about this one, but I'll give you some background regarding the session, if I have slides. Well, when we talk about the climate change, actually it's a complex system, we call the cascade impact, that we have the heat, drought, wildfires, and high PM, especially black carbon exposure, and that's leading to the human health. Next slide, please. Well, if we look at the climate system and the human system, it's much more complicated. Now, the climate change, I don't know, it's not my voice. Well, the climate change could trigger many events, the heat waves, and also the high frequency of ozone and wildfires and PM exposure. And there's many times we could have compound events that those could happen at the same time, and we are exposed to the same extreme events that could even cause, we call the synergic effect, and a much larger health impact. So that's why we are concerning about how to bring the climate system or climate change with air pollution, and in the future, we hope that we can dealing with this complicated human health impact through the mitigation and adaptation. So with this one, I would like to introduce the first presenter. She's Professor Laura Gallardo from the Faculty of Physics and Mathematical Science at the University of Chile and the IPCC author. Her presentation will be climate predictions for heat and wildfires and the link with air pollution. Let's welcome Professor Laura Gallardo.
Shishi, dear Tong. Thank you very much for being here. As I said before, muchas gracias por la invitación.
Thank you very much for the invitation, for being here in Cartagena again.
Ideas, messages regarding climate change, heat waves, wildfires, and their impact and their potential impact on health. Let me start by recalling a paper from 2021 where we had this nice picture in which this is a typical view that we see a fire, we see the expression of particulate matter, both organic and black carbon, where depending on the type of fire, the temperature, what is being burned, etc., we can see different fractions of this material, and that affecting their quality in terms of particles. But simultaneously, we have effects that also express themselves in the emission of ozone precursors that can show up on a shorter or larger distance from the fires. So we have a mixture of things that are acting together. And overall, what climate change has brought in is this, the new normal, so to speak, brings compound risks, not only one thing, one hazard at a time, and one vulnerability at a time, and one process at a time, but all of them together and interacting, which is difficult, is more difficult to assess because one has to deal with the complexity of these processes. And there are feedbacks. And one feedback is that if the frequency of fires increases, then that soil, for instance, that soil is going to lose the capacity to storage carbon, and that carbon is going to be around, probably in the form of CO2, which is going to introduce more heat and more temperature rise. So there are feedback loops that are important to consider. There is no linear thinking in this, but one has to take into account nonlinear and retrofed processes. And I won't go into the complexities of human health, which is also a matter of complexity. So we have a number of issues that are interconnected and complex, and we have to handle those. And this new normal, fires are here to stay, at least for a while. We have, over the years, we have already seen the effect of fires on air quality. This is a study from 2023 of Sue and colleagues, and that estimated the exposure to particulate matter as PM 2.5, but also the exposure to ozone in the context of wildfires. And to the right, let me see if over here, if things work, I don't know. No, we don't. But it was a nice representation of a fire we experienced in Chile, 2017, over the most populated area of the country between, say, Santiago, the capital, and 600 or 700 kilometers south of it, essentially burned for a month. And there is very little, there is no state power to face that type of phenomena which are different. This is not one-day fire. It's a sequence, a cascade, again, of fires that affected air quality significantly. They affected even the clouds over the Pacific Ocean. We could see the plume of these fires affecting other parameters in the climate system. And this is happening not only in the biomass burning regions that we were used to, but it's happening a lot in the subtropics. It's happening along California, it's happening along Chile, it's happening in Spain, it's happening in Sweden, it's happening in the Tiger region, it's happening everywhere, in Australia, etc. And this is becoming more and more frequent, more and more extended in terms of area and in terms of impacts. And again, it's not a matter of a day, 2 days, 3 days. It's often quite long-standing phenomena that are affecting air quality. Up to the medical community to say what are the mechanisms that are responsible for the effects and how they do compare with other sources of air pollution. Now, one of the hats I have, but I didn't come here with that hat, is part of the Bureau of the IPCC. So I'm taking this just as a common scientist and a scientist working under the umbrella of the WMO Global Atmospheric Watch Program, and in particular the Commission on Reactive Gases. So overall, with further warming, what we are seeing, and this is extracted from the summary of the previous assessment report, we see that every region is increasingly experiencing concurrent and multiple changes in climatic impact drivers. Compound heat waves and droughts are projected to become more frequent, including concurrent events across multiple locations, as I was describing. Increases in aridity and fire weather, the conditions of this 30% humidity, winds in excess of 30 meters per second and 30 degrees Celsius, is something that is expected with medium to high confidence. These adverse effects are also expected in the conditions of overshoot. That means going over the 1.5 degrees that we expected to reach with the Paris Agreement. That's a reality today. That is happening because of human activities, but also due to El Niño, some other type of variability we have in our climate system. But this is going to cause additional warming via feedback mechanisms I was talking about at the beginning, such as increased wildfires, mass mortality of trees that could also happen, the drying of peatlands, which is another phenomenon, and weakening the carbon sinks. So again, this feedback I was referring to before. And the world we're living in over here is very different for us that were born in the 50s, 60s, and 70s from the future that is expected for the people living that are, their birthdays are around these times. Their future is hotter overall, with more frequent heat waves and possibly wildfires. So it's a dimension that I would call we need to take more understanding. We need to work for a better understanding and to work further in order to understand the consequences on human health and also, of course, on the ecosystem and the climate system as such. Thank you very much.
I can have this one. So we can have a time. Ask one question. So just one question is regarding the wildfires. So are the climate system or the prediction capable to do the forecasted prediction?
Well, I think there is much more work to be done in those terms as well. Some climate systems, or climate models rather, they have a difficulty in representing fires. For instance, the vegetation doesn't disappear, which does, at least for a while. So there are things to do in terms of modeling. There is also the question of other factors, not only climate change, that affect fires. In the case of central Chile, for instance, it was no wonder there would be fires because we put, instead of native vegetation, we made a lot of investments in pines and eucalyptus, which are very, very flammable. So no wonder that after 10 years of drought and a heat wave, we had the disaster we had. But yes, there is the projections are still classified as medium. We are not completely certain, and surprises may lay ahead.
Okay, let's thank Laura again for her presentation. Speaker is Catherine Bussett, Director of Water and Air Quality Bureau, Health Canada's Health Environment and Consumer Safety Branch, and the WHO Collaborating Center for Environmental Health. And her talk is regarding the wildfire smoke impacts on health and the public health response.
Thank you.
Experience from Canada. So.
Thank you very much for having me here today, everyone. So it's my pleasure to bring you some examples of the Canadian experience with respect to wildfires, and also how the federal government, and in particular the Ministry of Health, is tackling those challenges. So just as a snapshot here, many of you well know, Canada is a very large country with a very sparse population. Most of our population lives in the south, 90% within 160 kilometers of the border with the United States. We're very lucky to enjoy vast wilderness across our country, including 9% of the world's forests. The top graphic shows the boreal forest zone cutting across Canada from east to west. And the graphic right below it shows the cumulative impacts of wildfires from 1986 through to 2022. On average, we have 2.5 million hectares per year that are impacted by wildfires. About half of those are caused by natural events, lightning strikes by and large, and those account for 85% of the landmass that's burned. So, as you would expect, human-caused wildfires through negligence, campfires, burning, those are put out very quickly because they're close to populated centers. 2023 in Canada was an unprecedented wildfire season. We had a staggering 15 million hectares burned by wildfires. So to put that in perspective, that's about the size of the country of England. And it was record-setting for us, more than double the previous annual land mass that had been impacted by wildfires. And sort of building on Laura's presentation, since the 1970s, we've seen a doubling of the impacts of wildfires in Canada, and our national experts on wildfire predictions are expecting a further doubling from where we are now to the end of the century. So I'm not going to belabor this too much. I think folks know that the impacts of wildfire smoke are widespread. It's not just for people who live in communities close to the fires. The map on the left from east to west covers about 2,000 kilometers. And that's giving you the sense of how the smoke from those fires in our most western province, British Columbia, are kind of spreading into their neighbors' areas. Wildfire smoke is a mixture. It's fine particles and gases. And within that mixture, it's believed to be that the fine particulate matter is the leading risk factor contributing to health effects. So while those who live near fires are the most at risk for experiencing health effects of wildfire smoke, because of how the smoke travels, there's the potential to impact large population centers that are not anywhere close to those fires, resulting in significant population scale health impacts. So as a relative point of comparison, I've noted 17% of the PM2.5 emissions in Canada are attributable to wildfire smoke. That's on par with the contribution from the transportation sector. What's interesting about this is that this is a growing PM 2.5 emission source that doesn't lend itself to normal policy levers, such as regulation. We also recognize that, fires are an important natural part of a forest ecosystem, and we have finite resources with which to fight fires in Canada. So firefighting is focused on fires that have the potential to impact communities' immediate safety due to the fire risk and critical infrastructure. But there are fires in the north of our country that are left to burn. They're monitored, but the reality of it's not within reality to expect that we would be fighting all of these fires. So this is a complex and different circumstance that we're working within. So I've included on this slide some information on the modeled impacts of the health burden of wildfires in Canada on an annual basis, both in terms of the short-term and long-term exposure impacts, as well as the estimated costs, which are upwards of 20 billion Canadian dollars, so about 15 million US dollars. I also wanted to highlight the graphic on the right is a relatively recent umbrella review on the health outcomes associated with exposure to wildfire smoke, which we published in May 2024. So looking at the mixture of wildfire smoke and its effects on health, as opposed to kind of trying to infer conclusions from a pollutant by pollutant approach. Within that review, we of course identified areas for research, for further scientific development, including how to consider the intermittent acute exposure over a season. As Laura indicated, in many areas within Canada, it's not a matter of 3 smoky days a summer. It may be 3 smoky days this week, 2 smoky days next week, like that for 4 months. And so what does that look like, and where do we blend between kind of these repeated acute exposures, and how does that transfer into a chronic exposure scenario? Also, this work highlights some emerging evidence related to impacts of wildfire smoke on neurological effects, cancer, skin and eye conditions, reproductive and developmental effects, and mental health as well. And it also identifies kind of an area for future work in better understanding the causes and factors that lead to disproportionate impacts within a population. Did not know that was. So what are we doing in the face of this challenge? One area that Canada is focusing on, given that this issue doesn't lend itself to regulation, is taking on a focus on public risk communication. So during a wildfire smoke event, when the pollution levels are very high, everyone is at risk, regardless of their health status. But there are, of course, certain areas within the population that are more at risk, including those who are older adults, younger children, pregnant people, those who work or exercise outside, as well as Indigenous peoples and low socioeconomic people who experience low socioeconomic status. And so we've gone forward with a layered approach to communicating with individuals, which focuses on, first and foremost, helping people find information about their local air quality. And then within that, encouraging actions that they can take to reduce their exposure and their risk. And there's a bit of a sample up here, and it's driven with the idea that people can kind of take some agency in the face of an external factor, and that can help people feel an element of control and power within the situation. So how do we share that information on the local air quality conditions across Canada? This is our National Air Quality Health Index tool. On the left is the web version. On the right is what it looks like on a mobile phone. And this is delivered to about 75% of the Canadian population as part of their weather forecast. So it includes current air quality conditions and a forecasted value on a very simple scale of 1 to 10, along with health messaging aimed at general population and at-risk populations across that scale. So that allows people to kind of self-calibrate their risk and provides that health messaging on actions that they can take to reduce their risk. Within another area with which we're taking action is the development of public health guidance and tools. And just a few examples here: guidance on cleaner air spaces. Those are places where public spaces where people can take respite from wildfire smoke. Guidance for provinces and territories on low-cost sensors, advice for public health authorities, and also a compendium of communications tools, such as social media messaging, Q&As, that we've shared with provinces and territories, as well as local stakeholders to help them in communicating to their constituents the health risks of air pollution. And I'll just leave you with this, a snapshot of our web hub, which is our main landing spot for wildfire resources. So that's canada.ca/wildfire smoke. And while these resources were developed specific to the Canadian context, you are very welcome to adapt them and tailor them to suit your specific context, and don't hesitate to reach out if you would like assistance or discuss those products. Thank you very much for your time.
Thank you, Catherine. In the sense of the timing, we skipped the question, but I think Canada has a set very good example how can we deal with the health impact of wildfire. So we move on to the third presenter. She's Professor Anita Peters from the Epidemiology Faculty of Medicine, Ludwig Maximilian University. I pronounced correct, right? And the director of the Institute of Epidemiology, Zentrum, Munich. So her presentation is regarding the heat waves and the air pollution effects on health and the key recommendations to protect health. Let's welcome Professor Peters.
So thank you very much. It's a great pleasure of being here and talk about the combined effects of heat waves and air pollution. So you have heard that indeed climate change makes wildfires more likely, but there are also other anthropogenic sources which are likely to go up due to climate change. And so while we have changes in sources, we have also changes in our atmospheric conditions. And we have, for example, new particle formation, which is much more likely when light and heat is present. So it's important to actually study the joint health effects. Before I discuss them, I would like actually to review with you the impacts of extreme heat. So there are direct health impacts, which are exacerbation of existing diseases and mental health. There are heat illnesses and heat stroke. There's increased hospitalization and increased death. In addition, there are indirect effects of heat. They include increased transmission of diseases, impacts on health services and facilities, disruption of infrastructure and technology, impacts on ecosystems, and impacts related to changes in behaviors and such as, for example, accidents. Well, with respect to air pollution, you have seen these pictures, and we have documented over the past decades that indeed air pollution is impacting first the lungs, but then really impacting the entire body. If we now look at recent evidence from Europe, we were able to show a link between increases in temperature associated with respiratory mortality. This was novel a couple of years ago because we thought that mostly cardiovascular diseases impacted. What you also see in this picture is that we compared low, medium, and high air pollution and exposures and looked at the risk of temperature in 148 cities. And you see at high air pollution levels, which was the 95 percentiles, the effects of heat are much stronger than compared to low, which was at the fifth percentile. When we selected European cities, we saw that indeed maybe clean and relatively colder cities like Helsinki have a really huge impact. But the impact was also there in Berlin, Germany, in Paris, France, or in Madrid, Spain. And taken together, in lung disease, air pollution worsens the health effects on mortality. In addition, we similarly looked at cardiovascular mortality and found also a consistent increase of the impacts of heat stratified by fine particulate air pollution. You may realize that the relative risks are slower in cardiovascular disease. And this is something which we kind of saw across different cities. There, the impact was actually larger, for example, in Berlin and Paris, and not visible in Madrid. This is a usual picture where you see that indeed you have some variation of the effect, but overall, the conclusion for Europe was air pollution versus heat effects on cardiovascular mortality. So if we put this together, we know that heat stress affects a specifically vulnerable population. These include infants, children, pregnant women, outdoor workers, people with pre-existing conditions, and seniors. And this all sounds very familiar because the same groups are also impacted by short-term impacts of air pollution. And indeed, we find acute health effects of heat and air pollution, both on cardiovascular and respiratory disease and mortality. And for air pollution, we know that air pollution really drives these chronic decisions, meaning that these susceptible populations are actually increasing. With respect to chronic heat exposures, we suspect that this really changes our living conditions and increases susceptibility. If I followed Francesco's discussion in the morning, but we are less sure about chronic effects of heat. So we wrote a technical note with the expert group for WHO, and there are priority actions. In the short term, it's very important to develop heat warning systems together with the World Meteorological Organization and assist the health sector to enhance governance, preparedness, and response to acute impacts of heat waves. In the long term, it's really important to address climate change and pollution jointly to limit the magnitude and the cost of extreme heat, and develop and report evidence on the joint risks. Member states have a really important role as they are kind of now putting up heat health action plans. They need to integrate air pollution in their plans and early warning systems, and also consider air pollution when they propose technical remedies towards heat or to support heat adaptation. In the long term, even more important, we need to change land use, urban and rural development to consider joint impacts and future projections on health and air pollution. We as academia, we need to really improve our health impact assessment because currently we still do this separately for heat and for air pollution. And we need to do research highlighting the benefits of action which address both heat and air pollution. And in the long run, we also need to close our knowledge gaps on the long-term consequences on heat together with air pollution. Finally, to my mind, the medical and public health community has a really important role. We need to develop guidance how to treat vulnerable patients and protect vulnerable subgroups. For example, we now know that people with underlying cardiovascular disease, their medication is harming them during heat waves. And it's very, very likely that air pollution just kind of puts an additional burden on that. We need to train medical and public health professionals to really, as we heard this morning, address air pollution, but also address heat at the same time. And we need to implement smart workforces as responders to heat and air pollution emergencies. And the wildfires are just a prominent example of that, and they will increase. In the long term, we need to alter and design future healthcare and infrastructures considering the joint impacts. And of course, also reduce the greenhouse gas emissions from the health sector. And with that, I thank you for your attention.
Thank you. Thank you much, Annette. We have some time to ask 1 or 2 questions. If there's any question from the audience. So, wrong thing with mic. Exercise.
Thank you very much. I'm curious about any synergistic effects from extreme heat and air pollution. In other words, if you have the same amount of air pollution and you have extreme heat, are there greater health impacts as a result? And if so, how well documented is that, and what are they? Thank you.
So, I mean, for the just looking at time series studies for mortality, I think nowadays this is really well documented, that we see simply increasing synergistic effects. So I showed you part of the data for Europe, which actually comes out of the multi-city, multi-country analyses. Mechanistically, I think so in order to cope with heat, our body tries to basically cool down. It opens up the arteries so that we can sweat more. But then at the same time, if you imagine that you also have a high particle burden in your lung, you have inflammatory processes ongoing. There's recruitment of inflammatory cells from the blood vessels. And if you then, for example, also kind of have a disbalance because you are on blood pressure treatment, this kind of is something where you have actually counteracting activities or counteracting pathophysiological changes, so that indeed it's very plausible what we saw in the European as well in the worldwide data. So, but what is important to realize, it's where we have a lot of evidence is the short term. So this is like acute things which happen together and put people at risk. But it's something which we really see, and as we have seen, as we know, it's going to our Earth is going to heat up for a while, even if we now take drastic measures. But air pollution is something which we can reduce, whereas reducing heat will be much harder.
I think George has a question. Short question?
Yes, is it on? Yeah, George Thurston, New York University School of Medicine, and thank you for a lovely talk, Annette. Now, you spoke, and I had a similar question, but you spoke only of the biological changes their interaction could have, but what about the aerosol side? Because warmer air generates the formation of fresh secondary aerosols. What about that side? Couldn't the particles becoming more toxic because of the heat?
Well, I think this is something, so we for sure see more particle formation. And I think this is something where we actually need to do research, because we don't have, and the nice thing about these particle formation events is that they're relatively large in spatial size. So they are temporal, But then you have a really, so if you have that occurring over a city, and it's like at the right height so that it mixes in with the air of the city, you have the whole region exposed. And I think this is a feature which we have overlooked so far. And I think it would be really important, those of us who are doing research on ultrafine particles and using size distribution measures to really tackle this question. I think at the moment we don't know.
Thank Peter Anders again. We moved into the panel session. We'll have 5 panelists, and when I introduce them, please come up and sit here, take chairs. The first is Kirk Douglas. He's a director, Center for Biosecurity Studies, University of West Indies, Cave Hill Campus, Barbados. And the second one is Inian Ignotti. She's coordinator for Minister of Health, Environment Health, Surveillance Coordination, Brazil. And the third one is Daniel Tong. He's a professor at the George Mason University and North American Regional Chair of the WMO Vegetation Fires and the Smoke Pollution Warming Advisory and Assessment System. And the fourth one is Nguyen Mani. I hope I pronounced correct. I'm sorry. Yeah, she's immediate past president of the World Medical Association and the World Health Professional Alliance. And the final one is the Tian Li. She's a deputy director of National Institute of Environmental Health, China, CDC. So we heard about the 3 presentations. I think the covered topic we are concerned about the heat and the wildfires and also the air pollution altogether. So if with all this message presented, the first question I would ask to Kirk Douglas is regarding this information. What's the element you think can be transferred across the geographic and the cultural context?
Sorry, could you repeat that again?
Yes. After we heard all the contents and about 3 presenters, what elements you think can be transferred across the geographic and the cultural context?
Okay, thank you very much. Well, first of all, thanks to the 3 presenters for very informative presentations. I think what jumped out to me was the linkage, the transmission of the information, because it's one thing to, as scientists, we capture data, we analyze the data, but then it remains within an academic silo. Getting that information out to the public in a manner that is easy to understand, and also for policymakers to also evaluate and then incorporate in their decision making is critical, because the analysis is only one part of it, is an important part, but just as important is the risk communication and to drive the actual action to help to solve the actual problem that we're trying to tackle.
Thank you. I just wonder, is this your slides or?
Yes, these are my slides.
So you may want to go through this?
Yes, so in relation to wildfires in Barbados, what we have suggested and recommended is a change in the land management at present. At present, we have a lot of empty lots, as you can see with the top left graphic. And during the wet season, you get an overgrowth of this type of vegetation and these types of lots. Then during the dry season, it dries out, and then you have persons who then ignite them. And this causes problems because their residences, there are also schools that have been closed. And up to, I think 2 weeks ago, we had schools in the capital of Barbados that actually had to close because of the smoke, not in the vicinity, but upwind from it. And so what we suggested is that they could actually clear some of these empty lots. It would have a knock-on effect. One, it's going to remove any of the biomass that is present. So there's no biomass, then there's very little risk of fire. What it will also do, it will also help with vermin and mosquitoes, which is a huge problem within small and developing states. And then we added onto that, because you have to do something with all of this vegetation and biomass that you're using. So the next slide then shows you what can be done, and incorporating it into a national biogas initiative where you take that biomass and then you convert it into a biofuel. So you're actually, oh, thanks. You're actually going to be creating a circular economy from the problem that presents itself. So you're not going to wait until it becomes a problem. You're going to be proactive, and you're also not going to be proactive, but you're going to create a sustainable system that's going to be generating economic revenue, and that will lend sustainability to the entire project. So that's what we are suggesting. And also, like I mentioned, public education and communication, being able to articulate to the relevant audiences within your population what is important, what persons need to know, and most importantly, what do they need to do and what do they need not to do. I think those are the very important things. So thanks very much.
Thank you. Thank you for providing your perspective on the Barbados, and also regarding the solution-wise, in the sense, in the mitigation. So my question to the Indian is the seminar. So all these elements, you think which one can be transferred across the geographic and the cultural context? Do you have slides?
Thank you. I have some slides,
Okay,
but I
great.
don't know if it's available.
Maybe you
Okay,
can
thank
move
you
on.
very much.
Yeah.
I cannot see very well.
Okay.
That's okay.
Yeah. Yeah. Yeah.
Okay, we experienced last year. Thank you. We experienced last year one huge period of drought, the most long period of drought, severe drought of the last 70 years in Brazil. In this map, you can see the area affected. It's almost all the country affected by severe or in some way long period of drought. And for this reason, it's arrived because the climate change, and usually we have in Brazil a dry period that it's registered many thousand of fogs of hotspots of fire. It's not new. As you can see in this graph, it's not new, but in 2024 was much higher, this bar, because the number of hotspots was much higher. As you can see, it's not new. It's a seasonal phenomenon. As we could notice, and in Brazil, in the area of the Amazon, for some part of the population, it was part of natural period of the year, like a season. But it's not natural, it's not a season of the year. And what happened last year was different, because the hotspot was occurring at the same time of heat waves, at the same time is time of low humidity, and affect all the territory. Then the hotspot was very close to big cities, even the capital of Brazil, in the center of the country. In this figure, you can see the violations of the air quality by municipalities in Brazil. Then you can see that this phenomenon affects the majority of the part of the country. And why I'm showing this, it's not different of Canada, it's not different of other areas, other countries, but the difference was the combination of climate phenomena with the period of hotspots, and not only by deforestation, not only by burning forest, but it was represented by wildfires. And the consequence of this, the concern in terms of health sector, beyond the smoke, the air pollution, was the scarcity of water. I know that this conference is about air pollution, but the main concern during that period was water, was vulnerable population, because the big rivers reduced a lot the quantity of water. Can you imagine the small rivers, small lakes, they disappeared. Then the most vulnerable population was isolated, completely isolated, without water, in consequence, without electricity, because the fuel, they could not arrive at the community. Then they didn't have electricity, they didn't have access to water for human consume, and at the same time, they are breathing air pollution, smoke. And this is absolutely extreme and different for our culture, for our scenario, and our concern. And what we are doing, we are trying to organize the database to respond to that situation, because we have a good, robust, important, big database about of health, about environment, but we don't know where exactly are living this vulnerable population. The geolocalization of this most vulnerable population that we talk everywhere, in every section. We know very well the group of most vulnerable population, but what we don't know is exactly where they are living. And this is my main message. Then this is part of our adaptation plan for climate change. If you talk about equity, if you talk about the vulnerable population, we should know where exactly they are living to protect them and change this scenario. Thank you very much.
Thank you, Ine. I think you're adding very important perspective in the sense this heating, the warming, and the wildfire not only impacts on the air quality, water, affordable water is also a very important one. So this cascade issue going on. And the second one you mentioned about the vulnerable people or population, that is also very important perspective to bring into consideration. Okay, so my question move on to the Daniel. Because you are wearing two hats, so there may be a couple questions for you. Okay, the first one is how common and effective are early warning and emergency management or response system for wildfires and or heat events in countries? Or if not, what are some of the barriers to introducing them and the challenging, most of the cost to implement them? So the first question, then I'll ask the second one when you respond.
Thank you for having me on the panel. I just speak on wildfires because I'm no expert on heat wave. I know a little bit about wildfire. The problem with the wildfire early warning system is we have too many choices. Okay, so sometimes you don't have choice, that's a problem, but you have too many, that's also a problem. So if you look at, this is just an example for North America. For the same event, you have 5 models, that all from credible agencies, not just a sitting scientist work. I mean, I have respect for them, but this is really, I'm saying it's not a mature forecast, but they give you very different results, right? So as a user, I'm confused, like which one should I use? So why is wildfire forecasting so difficult? Right? If you look at the emission data, you have a bunch of satellite-based emission data for real-time forecasting, and you have plume rise because fire oils rise above the ground and get released in the middle of the air. And you also have different weather forecasting to drive the wildfire air quality forecasting, and you have transport and deposition, etc. Right? If you put this factors together. So we designed this experiment with a single model, just changing these 4 parameters. We came up with 112 scenarios. And if you look at these blue dashed lines, those are individual forecasts. They can differ by a factor of 1,000. Right? That's what you get for the surface PM 2.5 concentration. A good news for this is if you look at the red line, there's a bold dashed line. And that's the ensemble, which is a simple average of all forecasts. You actually get very close to the observation. So that's the magical of crowd wisdom, ensemble forecasting here. So I will not going to talk too much about these details. This is just one example we are doing in the North America Wildfire Center, which is under the WMO Fire Initiative. We have put all the agencies from NOAA, NASA, the military all together, and we came up with this North America Regional Ensemble. This is one of the ensembles that our regional center currently developing. We put it together and we make customized products, and we hope to support WMO, WHO. We also have a city health dashboard, which we provide data to 750 largest cities in North America. So this model can be easily copied to other regions, but all the data are available. I think we cover every corner of the Earth. And another nice thing about this is give people confidence about the early warning system, right? You have one model, you either get it or you miss it. If you have ensemble forecasting, you can have the probability of the exceedance of the air quality standard. In most of the cases, if you have 100% of the models predicting exceedances, you have very good chance that you're going to get it. Okay, the opposite is true. So this is a new way of doing forecasting. Actually, the weather agencies, weather companies are doing it for a long time. So air quality forecasting should be moving to this way as well. I want to summarize my thoughts, just my thoughts for food for thoughts. Welcome any comments of what is next for early warning systems. I think we have some hard problems, which is it's going to take a long time to solve. For example, the satellite fire detection. So Kathleen showed earlier that the large Canadian fires, you also always see cloud and heavy smoke hovering above those fires. And that time, satellites will not be able to see it, right? Or if they see it, they will not get a fire radiative power correctly. So that's a problem. We need a better satellite sensors, better algorithm. There's uncertainty in the forecasting I showed earlier. Maybe we can go to ensemble or build better models. And there's also some low-hanging fruit. We can develop this make this early warning data set widely accessible. So the question from the chair is how widely we're using this in the countries. Right now, WMO Wildfire Center only have 2, right? One over North America, another one over Southeastern Asia. But the data is everywhere. So I think it's a low-hanging fruit that if we have coordinated this data distribution, we can make this accessible to everybody. The product can be made more user-friendly for health people, for daily people. And also, I think the health surveillance system should consider this episodic events, not just recurring air pollution. I will end here.
Thank you, Daniel. You have indicated how the atmosphere scientists can contribute to forecasting or prediction events like this one. I think the second question is more like for the public health perspective. You can answer or not, refuse. How can public health surveillance system to be adopted to respond efficiency and effectively to the acute health service demands?
Yeah, this is actually falling out of my expertise. But I think the first thing is we should start to consider these episodic events, like extreme events, into the public health surveillance system. But I wonder other people are more talented than me in the panel want to answer this question.
I still have 2 panelists to be able to capable and to address this question. I would like to ask Nujuan. Yes. So the question is, what are the best way health sector can advise citizens, people with pre-existing conditions and the most vulnerable groups? So I guess that's how we can make some mitigation.
Yeah, thank you. That's an important question. I think the healthcare professionals play an important and crucial role in guiding vulnerable populations, given the increased burden of chronic diseases, climate change, and the health threats. Healthcare professionals must provide accurate, scientific-based communication targeting those groups. So, drawing upon the conclusions and the framework that has been designed by the World Medical Association, which is an organization representing over 10 million physicians around the world, as well as the World Health Professionals Alliance that represents physicians, nurses, physiotherapists, dentists, and pharmacists. That framework really highlights the importance of risk communications, community-based engagement, strengthened health policies, as well as the advocacy for equitable healthcare access. If we focus on the communication, according to the WMA Declaration of Geneva, which is a much modified version of the Hippocratic Oath, it's the physician's ethical duty to provide accurate, relevant health information that is based on the patient's medical background, socioeconomic status, as well as literacy level, to know what are the health impacts of situations such as wildfires and heat waves, what kind of health signs we need to look for, and when to seek healthcare services. It is also important that these information are accessible, available in multiple languages, in different edu formats. And as part of the communication, I also want to address the dangers of misinformation. As we saw during the COVID-19 pandemic, the healthcare professionals have the responsibility to combat misinformation and really guide the patients to trust information sources such as the World Health Organizations, the national health authorities, as well as the professional medical organizations. The second thing is the importance of early detection and prevention. So those vulnerable groups should continue to have access to community-level clinics, early diagnostic and detection tools, and for checkups. Particularly when there is a risk for heat illnesses and heat exhaustions, as well as for smoke inhalations. We've just heard about the early warning and detection systems, and I think that is quite important that such patients should receive tailored alerts and messages when there is an increase or there's a wildfire or there's an increase of air pollution level or during heat waves, on what kind of signs that they would look for and how they can prevent themselves. As we saw the great example from Canada that I think could be applied in multiple countries. The second thing is the lifestyle modifications. Simple advice such as hydrations and adequate nutrition would be greatly valuable. And now talking about advocacy and policy change, as many of you know, we're really behind SDG 3, universal health coverage. And adding the environmental determinants of that target, including situations such as heat waves and wildfire, it pushes even further behind. So it's important to advocate for equitable access to healthcare services, including medications, diagnostic tools, and community-based clinics. To address also the financial burden of healthcare services, to provide financial means to make even medications more affordable, and to advocate for a holistic health policy framework that addresses social determinants of health, not also environmental ones, universal health coverage, and even push the government to have a better, stronger response systems, particularly targeting the vulnerable groups, and a better, stronger air quality measurements to combat the wildfire smoke inhalation. I really liked the point that was addressed by previous speaker, which is the importance of the sustainability of the healthcare systems, which is actually correct because the healthcare system have their own contribution into the climate change and air pollution. But it's important that such systems are not only sustainable, but they're also resilient to be able to continue to provide healthcare services, not just to the vulnerable groups, but also for the wider population. And as part of that resilience is capacity building and training for the healthcare professional. And last but not least is to even healthcare professionals, we are actually actively advocating for green spaces to compact heat islands in the cities. I'll stop there. Thank you.
Thank you, Nujie. You actually provide a holistic perspective on the health authority and medical care professionals. That's a very important one. Thank you. So I move on to the fifth panelist, Tian Tian. So the question is, how can public health surveillance system to be adopted to respond efficiently and effectively to the acute health service demands? You may address. Go ahead.
Thank you. I will start from a Chinese example. Yeah. Okay, I will jump to the. Okay. Now I'm using a Chinese example to start my question. Yeah, there was a fire in 2022 in August in Chongqing, which is a city in China, in the southwest China. And this city is actually very hot. It's the most hottest cities in China. The temperature in summer is normally around 26 Celsius degree, yeah. And it's dominated by the mountains and the hills. The forest coverage rate around 55%. Starting from August 17th, last for 10 days, there were 14 wildfires impact on 10 districts. On that year, compared to the previous years, there was a record-breaking heat temperature. The maximum temperature is around 14.5 Celsius degree and very low participation. So there was actually heat wave and wildfire compound events. You can see very clearly during the wildfires, the maximum temperature actually every day about 14 Celsius degree, and all the fire spot is cover the forest area. And I think there is most successful thing is that we have very good early warning system that plays an important role. 1 month in advance, the early warning system actually gives the highest risk alert. And from 1 week to 1 to 3 days, again, there was many signals about the highest risk alert. There also hourly level forecast, which played an important role actually to monitor the development of the fires. There were also 16 release channels, including WeChat. We use very commonly in China, and the cell phone and the TV, and so on. Yeah, and based on all this information, there are a lot of very effective response actions during the warning period, before the disasters, and during the disasters. Actually, this early warning system is very advanced, pressed by the Deputy Secretary of General WMO. Yeah. Okay, now I will give a very quick introduction of China's early warning system. Yeah, for heat and wildfire. So we have very mature and in-running early warning system for heat, which is established by the China Meteorological Administration, CMA. And also now our NDCPA, National Disease Control and Prevention Administration, collaborating with CMA, we jointly established a heat health early warning system, and will plan to jointly release this year in China, yeah, for all the public. And for the wildfire, we have early warning system, wildfire early warning system, which was established by the CMA and IMEM, that is Ministry of Emergency Management, and NFGA, National Forest and Grassland Administration, and have three risk levels. However, for all the responses, mainly focus on the firefighting, no public health response, actually. Yeah, so I'm going to answer the question. Yeah, for heat and wildfire, we have heat, early warning system, wildfire, early warning system, heat and health. Now we are going to release. But how to achieve steady progress in technology and strengthen the public health for the wildfire and heat? So I will give three answers. I think one is we need scientific evidence for the compound events. The second one is to optimize our early warning system. And the last one, we need multi-department collaboration. We already know very sufficient for the heat and health. We know some about the wildfires and health, but we know very little about the heat and wildfire compound events. So we need to establish the systematic evidence on the health effect associated with exposure to heat, wildfire, as well as compound heat and wildfires. The second one is, I think, for the common situation for heat or wildfire, we have independent system. But in the event of wildfire and heat, I think we need the integrated system for the heat and wildfire and related health risks. Yeah, so that we can establish an integrated early warning system that can quick switch from the common situation to the compound event for the wildfire and heat. And the last one, I think is very important one, is for the multi-department collaboration. Now for the wildfire, I think most response or the mainly response is for the firefighting. But we need not only firefighting, but also firefighting and protecting public health response. So for the emergency department, mainly response for the firefighting, for the meteorological department, mainly for the trend prediction, forecasting, early warning. For our public health department, we need a health response or health risk early warning. And for the medical care department, for the medical risk cure, so we need to establish a multiple department cooperation among the department for the emergency, meteorological, public health, and medical. Well, that's all for my answer. Thank you. Yeah.
Thank you, Tian Tian. I think your message is very important regarding the response and also how the multi-department collaboration, I think that is the issue we are concerned about. So we still have some time to have open the floor for the question. So.
Thank you so much. Ricardo Morales from Universidad de los Andes in Colombia. I just wanted to quickly ask the panelists about something that was kind of spoken there but not fully addressed, is that the difference in the origin of fires depending on the region we live in. So in Brazil, it might be soybean plantations that are driving deforestation, and then the fires are really man-made. The same thing happens in Colombia. We heard from Professor Laura earlier that there is a big anthropogenic component in the fires. In Chile, it is clearly not the same situation in Canada. In Canada, it's more like responding to climate. In low and middle income countries, it's actually driving climate change because our emissions, greenhouse gas emissions, are driven mostly by deforestation. So I see that as an opportunity because you can actually stop deforestation and improve land management techniques and so on. So I don't know what's your take on that, if there is something to be done there. Thank you so much.
So who would like to address? Okay.
Thank you, Professor. Yes, that's true, but it's not so simple because Yes, the agriculture and the activity, agribusiness, is a drive-in to deforestation. That's true. Everybody knows about this. But it's not only the. I spoke very quickly. The change now is that the climate influences also the intensity of the fire and the area affected. Then it's not so controlled the area of the deforestation. Then it affects also last year in Southwest, in São Paulo state, for example, close to Brasilia, for example, we had important and intense wildfire also. This is the difference. Not only the number of hotspots, but the determinant of the hotspot was a big difference. And I didn't spoke, of course, about the consequence of the air pollution because I try to highlight the other problems related of this. Thank you.
Yes, there are natural fires and also man-made fire. Fire is a tool used by humans for a very long time, right? So in the agricultural region, and like Central America, we have a lot of fire smoke, right, from that. And the forest, as mentioned earlier, that's driven by fuel and also by climatic conditions, right? So there are three factors: ignition, fuel, and weather. So that's all controlled by, except the ignition can have human interference, but all these others are controlled by climate change. I think it is from the health perspective and also from the early warning perspective, these small agricultural fires actually pretty difficult to predict and also to regulate. Just add here.
Okay, thank you.
Yeah, and I think from the context of a smaller and developing state like Barbados, what we found, we've done some research in Barbados looking at wildfires from, I think, about 2006 to about 2024. And the general consensus from those involved in fire management is that almost 95 or higher percent of those fires are started by humans. Oftentimes, you see a fire that starts at 3 or 4 a.m. There's no sunlight, there's no heat to cause an ignition at that time. And that actually offers an interesting challenge. Whereas we look at it from a scientific point of view of the intersection of climate, the intersection of health, but also we have to, I think, embrace the social science aspect, because what we're dealing with, particularly for the ignition source in smaller developing states, and as you would have heard the colleague said in South America, is really human behavior. And even when you think of, as my colleague here mentioned, in terms of dealing with the actual patient and their behaviors and modification, whether this is hydration, etc., that's also behavioral modification. And so communication then is going to be ultra critical to be able to communicate why this is not important. Also interventions. We had some talks with the fire service, but we also included, for instance, the Office of the Attorney General, because what you're dealing with are usually younger males, sometimes older males as well, and they're arsonists, and it's a criminality that's attached to it because it's illegal to set those fires. But then you have to see what's the best way to modify their behavior, and so you have to bring in those social scientists, persons within the legal and the criminal fields to find the best solution to start to target them, and maybe if they have an interest in the fire service, enroll them in a volunteer program that can help them to satiate that need to see fires and be close to them, rather than trying to imprison them only, because then they come out and they do the same thing yet again. So it's a very complex issue that you're looking at. It's an intersection of science, yes, medicine, yes, but also social science and social behaviors. And I think we should really be aware of that.
Yeah, go ahead.
Yeah, let me just add another circle to what you flagged, which is the food system. Yes, in terms of the wildfire, climate change plays an important part, but around 1/3 of the greenhouse gas emissions comes from food systems, and that really contributes to the climate change. So as you said, because of the current agricultural practices, increase the risk of wildfire, and even at the same time, these agricultural practices contribute to the climate change, has the risk also for wildfires, would lead to land degradation, soil degradations, and it's quite really important actions is to halt land degradation and the land expansion. So in addition to the groups that you have mentioned, we need to include the farmers to see how can we develop win-win solutions to secure their livelihoods, to produce not just more food but better food that can protect the land and decrease the level of deforestation. And that's very important department, I would say, or a sector that's included in the framework when we address issues such as wildfires.
Okay, thank you. So we have one more question. Yes, go ahead.
Hi, I'm Daniela from the Inter-American Association for Environmental Defense, and I would like to take the opportunity to just say thank you for the panelists, and also like you are from different regions of the world, and we know that the impacts of wildfires is not just in the country where the fire is, it's also a transboundary impact. So I would like to know your thoughts about that topic, like transboundary impacts of wildfires, and also if you know any kind of international coordination mechanism to prevent and manage wildfires, or what can we do about that issue?
Very good questions. Who is Daniel?
Well, I'll take a first stab at it. I don't think I'll be very good at it because within the Caribbean, we are archipelago of islands. And if you have wildfires on one island, I don't think that you will necessarily see a direct impact. The closest thing I could remember of an airborne pollutant having a problem or causing a problem was the eruption of the La Soufrière volcano in St. Vincent. And the air currents actually pushed the volcanic ash over Barbados, and we had almost midnight conditions at noon because of the volcanic ash. But that was a very rare event. But in terms of the wildfires within the Caribbean, I can speak to, they're more or less localized to within the actual island or the island country. Yeah.
I think that there is many. I'm so sorry. I was looking. I think that there are many kind of cooperation between countries, especially in South America, but the cooperation was established among different areas, separated areas, like a scientific area, chemical of atmosphere, fire, fighter, and not one aggregated of areas. We could organize it better. But I think that there are many kind of coordination, especially with the technology of satellites and modeling. There are some cooperation, but could be more coordinated. That's it.
Yeah.
I think, okay. I think early warning system is very important one. So we need the evidence first. So, international collaboration for the, multi-countries evidence for the wildfire heat and heat. I think this is the first step to, to establish the early warning system. So this is my answer. Okay.
Yeah, transboundary issue is very common, not just for wildfires, also for ozone, for dust, for other things. Right, so this is something that's just a part of the nature's force. We cannot do much about it. But it will help us to work together. Right. Another one interesting thing we observed last year, actually 2 years ago, when we have this Quebec fire from Canada and make Washington D.C., where I live, and then also New York City, the dirtiest cities in the world for a few days. This is very unusual in that most of the time the smoke from Canada will be blown into the Atlantic Ocean or go to Europe. But that time, just the wind just changed, right? And the reason for that is because that's a no pressure system right next to the fire, and then they change the direction of wind. Interestingly, because of global warming, the wind patterns, the large system circulation is going to change. Right? So you are going to see a lot of fires exported from one country to another country that usually you do not see in other time. So this is also a very interesting aspect of the interaction between fire, climate change, fire, and air quality and health.
I actually forgot to mention, I don't know what percentage of the Sahara dust involves smoke from the Sahara region, but we definitely feel the effects of transboundary Sahara dust. I have my colleague over there, Dr. Andrea Seeley. She's with I think she's the chair of the World Meteorological Organization for the Western Hemisphere. She can tell you all about Sahara dust if you want to know more about that.
Okay, thank you. We have Sarah, and then that's.
Hello, I'm Sarah Bazard from the World Meteorological Organization, and I want to mention that there is an activity connected with vegetation fires and smoke pollution that is regional, and we are really trying to coordinate some transboundary activities through this program. Now there are 2 regions where we are targeting, that is North America with Canada and the States, and also Southeast Asia, which is one of the target regions. But the mission is to include more regions and more regions because we know that each region is having their own specific particularities. Then we need to create a specific strategies with the countries to combat fires. And just to let you know, at 4 there is the San Andreas Storm Session. You are welcome to participate. And there's one day tomorrow, of course.
Thank you, Sarah, for the more information. There's a gentleman there. Last question. There are 2.
Sarah Varunachalam from the University of North Carolina, Chapel Hill, USA. It's more a comment than a question. By the way, thanks to all the speakers and the panelists for great talks, great topics, great insights. I want to switch the topic a little bit to talk about something which I did not hear, and that's going beyond wildfires, looking at fires at the intersection of wildland-urban interface. This is an emerging area of interest. There was a forecast put out by a group at NCAR, the National Center for Atmospheric Research, which projected that this particular area burned from WI will grow quite a bit in the next couple of decades. And we saw the devastating LA fires in Los Angeles early this year, which burned quite a lot of urban area. And from a health point of view, there's emerging evidence to show that the health impacts of these fires from WI are a lot different compared to what we knew from traditional wildfires that we've been talking about so far. For example, some folks have measured extremely high values of lead in the LA region. Of course, so imagine all the junk we have at home, the electronics, and then they go burn, and the kind of heavy metals that come out there. So from a health perspective, we got a lot more to look at from the wildland-urban interface beyond just the wildfire-based impacts. Thank you.
Thank you for the comments. We have the really final question, the gentleman behind there.
Final. Thank you for this discussion. One small note, we didn't mention there are 2 occupational groups that receive high exposure. One is firefighters, and we should recognize that firefighters is considered in group 1 profession at carcinogenic risk from the IARC. And they are also exposed to dehydration with the possibility of acute renal failure. And the second occupational groups are cleaners. You have to imagine, after the fire, you have to clean. And very often, only migrants and very low workers are employed in this activity. And this is extremely high-risk occupation, also because the toxic material that you have. So I think in all the documents, the occupational exposure should be mentioned.
Thank you. Okay. Any response or is just comment?
Yeah, I would definitely agree. The firefighters I know from in Barbados, they are brave men, but I do agree that we need to have stronger occupational health and safety provisions for them. The cleaning, I guess that would vary from country to country, region to region, different socioeconomic backgrounds, etc. But yes, most definitely, and also to the gentleman before, yes, the wild and urban interface is definitely something that we have to pay attention to, because now within the Caribbean we have a situation where we are small island, and by small island we have very limited land space. We have persons who want to own their own homes, so there's pressure on what remaining land that is there to be sold into development. But then there are other areas that may be interdispersed that are overgrown, where people dump garbage, and that's another thing, because when we do have wildfires in Barbados and some Caribbean countries, it's not just a wildfire, but it could actually be a hazmat fire because of the solid waste that is actually discarded in the environment. And now that we're in the age of social media, mobile phones, we have lithium-ion batteries, we have so many other different toxins. And finally, within the context of climate, Barbados is the 15th most water scarce country in the entire world. And we have a very interesting convergence of risk between January and May. We have one, it's the dry season, so we don't get a lot of rain. Two, we have 3 times the amount of tourists than we have residents that live on the island. So between that time, our population jumps at least times 3, and that increases the demand on the limited water resources. And that's also the peak wildfire season, and that's also the burst season where the underground pipes burst across the island because of the dry conditions. And so it will get increasingly more difficult for small and developing states like Barbados and those throughout the region, because we share several different common characteristics. And so it will become increasingly more and more important that we have higher levels of detection, not only of PM 2.5, but
Correct.
I would even include microplastics.
Excuse me, Kirk, maybe short, because we run out of time.
But yes, that's where I'll leave it.
Yeah, thank you. Yeah.
Just to complement, last year, the Brazilian Ministry of Health published a guidance for these workers, this category of workers, because it's an important concern. And to complicate a little bit more, during the wildfire, the groups of firefighters are moved to other region. That means many times another biome. For example, from Pantanal wetland to Amazon region or to Cerrado, that is similar savanna. And it's a complication because they do not know very well that kind of nature. It's one example of the increase of risk of their work and their lives. Thank you.
Okay, we are running short of time. I have 2 slides, but it's not showing here. So I think it's going to be some take-home message, but I think about too many information and too many thoughts to be taken. Because we are here talking about the heat and the wildfire, as very important is the nexus of climate change, air pollution, and health. So 3 very important factors challenging to human society. So how can we working together? This has been, I think, the question and the challenge. And so I'm very happy that this session is co-organized by WHO and WO. WHO is from Sophie and Karen. I would like to thank you. And also from WO is from WO side is Sarah and Paulo. We thank you for your support. And we have wonderful 3 speakers and 5 panelists. Let's give a big applause to them to thank you for your attending the conference. Welcome. So I think our session is closed, and you can enjoy coffee. Yeah, thank you.